I'm going to talk about, touch on the new guidance for congregate living settings. And I've included links and just a pointer. If you'll see my PowerPoint presentation displayed on your screen, and if you hover over the presentation, you'll see some arrows, so you can actually go back or go forward while I'm doing my presentation. And if you want to click on any of the links during the presentation, you should be able to access them that way, as well as the links will be live in the PowerPoint presentation that we will send out to you after the workshop today. So you'll be able to access those links in a number of different ways. So on October the 6th, we had some new guidance, and I know that all of you are demonstrating great flexibility as we have maneuvered throughout the pandemic with different guidance and different approaches. So on October 6th, the long-term care retirement home and other congregate living setting guidance was released. And this is new in that it combined long-term care retirement home with the congregate living setting guidance. So it's all in one document now, whereas we had two documents previously. And included in this document on page 29 to 31, you'll find the guidance for case and contact management for residents. And it has been changed. And I have a few comments about the changes in a slide in this presentation. And then the management of cases and contacts, that guidance document was updated at the end of August, so August 31st, 2022, and that guidance provides guidance for return to work for individuals that work in a highest risk setting, and you can find that information on page 16 of that document. And the direction is that staff that work in a highest risk setting are eligible to return to work 10 days after symptom onset or date of specimen collection, as long as they are feeling better and do not have a fever. And as I know all of you have dealt with the challenges of staffing crises, and I know many of you are familiar with the guidance related to early return to work in those situations when you need staff to return to work early because of your staffing situation. One of the other questions I received before the workshop was related to eligibility of staff for molecular testing. And that guidance is a newer guidance document. So it was revised and was available on October 6th, and that document is called the Provincial Testing Guidance. And on page 4, it outlines that staff that work in a highest risk setting, which a congregate setting is considered, are eligible for testing. And I know from time to time we've had to do some promotion with our COVID testing centers to provide them with a little bit of guidance as to who should be included in their testing criteria. So if you feel that some clarity needs to happen with some of the testing centers, please let us know and we can do some advocacy on your behalf if you are running into difficulties with testing. So I'll just review briefly some of the guidance about case management of residents. And I know that congregate settings have been looking for this guidance update so that your residents can return to the activities that they normally do sooner than the 10 days, which has been the period of time that they were required to isolate in the past. So the revised document outlines that they need to isolate for 5 days and until fever-free and symptoms are improving. They need to wear a mask in the congregate setting and outside of the congregate setting for an additional 5 days beyond the 5-day isolation period. However, that is setting specific. So if they are one of your residents that goes out to they have employment, so they have a job that they go out to do. Then while they're outside of the setting, the community guidance applies. And that community guidance is if their symptoms have been improving for 24 hours for respiratory or 48 hours for gastrointestinal symptoms, they can resume attending other settings in the community with precautions of masking and avoiding vulnerable individuals and other high-risk settings for 10 days. And that the guidance is outlined on page 30 of the COVID-19 guidance from October the 6th. We've had the Ministry of Child and Community and Social Services reach out to our IPAC Hubs. They're working on a summary document that I know you'll find helpful, and we are providing some consultation with MCCSS for their summary document that will be helpful for the agencies that fall under their jurisdiction, that summarizes the guidance document from the beginning of October. I just wanted to highlight for you that staff and residents may be eligible for treatment with Paxlovid. So this hyperlink here looks at the eligibility for treatment with Paxlovid. So that is what we can call an outpatient treatment. So it is by prescription that a healthcare provider can provide. And one of the things I would encourage you to do would be to look at this screening tool. And I've just done a screen capture of a screening tool that's available that you could use ahead of time to determine if you or some of your residents would be eligible for antiviral treatment. And Robin is going to give a presentation a little bit later this afternoon about outbreak reporting. And I just wanted to highlight on page 2 of the new guidance that there is a description of some of the legislation that describes outbreak reporting and the responsibilities of institutions to report outbreaks. And Robin will provide some more guidance about outbreak reporting, but just wanted to draw your attention to page 2 of the guidance document that outlines the description of institutions that fall under the Health Promotion and Protection Act.